what tests should be done on a child when there's a suspected hearing loss? That's a great question, and it really depends on how old the child is. So typically kiddos age 5 and older, if they're normal developing, most of the time those kids can raise their hand when they hear the beep, and so you'll get what's called conventional audiometry done. So you're going to hear some beeps, the kiddo will raise their hand or push a button, they'll repeat back some words, and then of course we're going to do what's called tympanometry, which is looking at the movement of the eardrum. We're going to make sure there's nothing behind the eardrum that could be causing the hearing loss. And then they're going to do what's called otoacoustic emissions, which is like a hearing test without the child needing to respond. And so the child will sit quiet, they'll put a probe tip in the ear, the child's going to hear some beeps. I like to call it like R2-D2 from Star Wars. It's just like a bunch of beeps, and the kiddo just has to sit there quietly. And when we hear sounds, our hair cells send out an echo. And so that machine is going to measure the echo. If the echo is loud enough, we know that the child has essentially normal hearing. Now, what if the child is under the age of 5? Well, we're probably still going to try to do tympanometry. We're probably still going to try to do otoacoustic emissions, but they're probably not going to be able to raise their hand when they hear the beep. And so we might do what's called visual reinforcement audiometry or conditioned play audiometry. And this is just a way that we can reinforce the child's responses. So maybe in sound field, or they're wearing headphones, they're going to hear some sounds or some speech. The child's going to turn their head, and a toy is going to light up to reinforce the child's behavior of turning their head when they hear the sound, right? That's visual reinforcement audiometry. Conditioned play is where we're just conditioning them to play only when a sound is presented. So we might have a little block. We put the block up near our ears. We're listening for the beeps. When we hear the beep, we go, ah, and we put the block in the bucket, right? And so we'll condition them to do that task only when the beep is present. Now, if the child's unable to do those types of tasks, right? It could be that they're really young, under a year or two, right? Or there's multiple things involved, multiple diagnosis. We might do what's called auditory brainstem response. And this is where the child can be sleeping, possibly sedated, but we're testing their hearing without them needing to respond. They have to lay really still and quiet for an ABR to be effective and get reliable results. But that's another test that we might do on a kiddo, again, depending on their age and their development. So I hope this was helpful. What you can do for the family is just be supportive. 100% do not be judgmental. They need to make a decision that's best for them and their child, and just be there to listen and help them if they ask for it. You can look up resources, right, for kiddos with a hearing loss online, or just be there to be a shoulder to cry on or an ear to listen to. I hope that was helpful, friends. I'm Dr. Maria Morrison, audiologist. I'm your expert in hearing healthcare. Keep those questions coming and have a great day. Bye-bye.